My name is Marty Seeholzer. I'm a benefits coordinator for Cuyahoga DD.
My name is Michael Busek. I am also a benefits coordinator for the Cuyahoga County Board of Developmental Disabilities.
And we are here to tell you what you need to know about working and Title II Social Security disability benefits. Title II disability benefits. There are 3 programs included in the Title II disability program. These include SSDI, CDB, and DWB. Those are defined as Social Security disability insurance, child disability benefits, and disabled widow/widowers benefits. This is an insurance-based disability program that pays cash benefits to insured workers who have become disabled and unable to engage in work activity. This program was created in the 1950s, and it provides a safety net to workers who have paid into the system for a specified time period by having FICA taxes withheld from wages. The time period is based on the worker's age at the onset of disability. FICA withholdings also insure workers for retirement and may pay benefits to dependents of the insured worker. SSDI beneficiaries receive Medicare benefits after receiving 24 consecutive monthly cash payments.
Slide 3, Title 16, Supplemental Security Income, which is also known as SSI. I just want to reiterate before we start that this is different from SSDI. So SSI is a means-tested program that provides income to individuals who are blind, aged, or disabled. The program was created in 1974. Financial requirements and restrictions must be met continuously to be applicable for this program. It provides a universal income for beneficiaries nationally, and several can provide a supplement to the federal benefits that they may receive. SSI beneficiaries automatically receive Medicaid in the 42 1634 states. So currently, Ohio is one of the 1634 states, which means if you are approved for SSI benefits, you're also approved for Medicaid. This is all financed by the general funds of the U.S. Treasury. Maximum SSI amount for 2024 is $943 for individual, and it's $1,415 for a couple.
Definition of disability. The Social Security Administration defines disability as the inability to engage in any substantial gainful activity by reason of any medically determinable physical or mental impairment, which can be expected to result in death, or which has lasted or can be expected to last for a continuous period of no less than 12 months. This is used in both Title II and the SSI program. Impairment, duration, and work limitation are the claimant's burden to prove. Applications can be made online or at the SSA field office serving the claimant's location. The completed application and supporting documentation goes to the Disability Determination Services for a disability determination.
Evaluation. Is the claimant performing substantial gainful activity? In 2024, SGA for a non-blind individual is $1,550. For an individual with blindness, this is $2,590. Does the claimant have a severe impairment or combination of impairments? This is also needed as part of the evaluation. Does the claimant's impairment or combination of impairments meet or equal the severity of a listing in the SSA listing of impairments? If the claimant's condition does not meet or equal the severity of a listed impairment, does the claimant have a residual functioning capacity to do their past relevant work? If their past relevant work is excluded, does the individual retain the residual functioning capacity to do other work of that kind that exists in significant numbers in the national economy? So these numbers essentially are the way that they evaluate the forms with Social Security Administration.
Insured status for SSDI. Earning credits. 1 per calendar quarter, a max of 4 per year at a rate of $1,730 in earnings per credit in 2024. The number of credits required for disability benefits depends on age and the onset of disability. If disabled before age 24, a person generally needs 6 credits during the 3-year period ending when the disability begins. If disabled at age 24 to 30, a person generally needs credits for half the period between age 21 and the onset of disability. If disabled at age 31 or older, a person needs the number of credits in the 10 years immediately before they become disabled.
Childhood disability benefits. This was formerly known as disabled adult children. If you're unmarried, 18 years or older, and you are deemed disabled by SSA's definition before the age of 22, this means you're applicable for childhood disability benefits. The child of the insured worker who is either disabled, retired, or deceased. So that means if a parent either passes away or if they retire, that the child is able to collect SSDI benefits on their behalf. In certain cases only, they may be dependent on a grandparent or a step-grandparent. If receiving SSI already, Medicaid remains intact, even if it becomes ineligible for SSI upon CDB eligibility.
Disabled widow/widower's benefits, or DWB. It's a prescribed period of eligibility which begins the month of the spouse's death or the insured worker, including a divorced spouse. The last month of entitlement to a mother/father's benefits, the last month of previous entitlement to DWB, and ends the month before the widow/widower turns 60, or the end of the 84th month 7 years after the period began. If receiving supplemental security income already, you get to keep the Medicaid eligibility remains intact, even if the individual becomes ineligible for SSI upon DWB eligibility.
Legislation and work incentives. Work incentives, these are employment support provisions that assist beneficiaries in moving benefit dependency to independence by protecting eligibility for cash payments and healthcare retention. Congress wanted to provide opportunities and encourage beneficiaries with disabilities to return to gainful employment. A limited number of beneficiaries return to work at work levels sufficient to leave the program once benefits are awarded. Legislation and regulatory changes have added work incentives aimed at reducing the risks of returning to work. So a few examples of these work incentives would be trial work period, extended period of eligibility, extended Medicare, expedited reinstatement, impairment-related work expenses, subsidies and special conditions, income averaging, and unsuccessful work attempt.
Slide 10, trial work period. The trial work period is a 9-month period within a 60-month rolling period to test a beneficiary's ability to work. The beneficiary works for pay and earns above the trial work period level, which in 2024 is $1,110. Benefits are paid during the trial work period regardless of earnings. The 9 months do not need to be consecutive, and they must all fall within a 5-year period. To begin charting trial work period months, always determine the first month that was above the trial work period. And no other work incentives apply during the TWP.
The extended period of eligibility. The EPE period starts the month after the trial work period ends and continues for the next 36 months, regardless of whether work continues. This means it's a simultaneous action and it will continue forward. For any month during this period when the beneficiary's countable earned income is less than the SGA level, which in 2024 is $1,550, they receive their SSDI check. During the re-entitlement period, if work or monthly earnings are below the SGA period, benefits are payable. If work or monthly earnings are above the SGA, benefits are going to be suspended for that period. So there's also the cessation month. This is the first month of work or monthly earnings that exceed the SGA after the trial work period. There's also the grace period, which is the 2 months immediately following the cessation period. During these 3 months, you will still receive the SSDI paycheck.
Countable income. The Social Security Administration counts only earnings that represent the individual's work effort or productivity. Sick and vacation pay is not counted. Neither is bonus and incentive pay unless evidence shows that it is not related to productivity. Earnings in a cafeteria/flex spending plan added to gross earnings before the substantial gainful activity determination. Countable income equals the portion of income that remains after work incentives are applied. And several work incentives impact the countable income substantial gainful activity decision. Income averaging. Income may be averaged to reduce the countable income to below substantial gainful activity. The pattern of work is or was continuous, and there's been no significant change in work patterns or earnings, and no change in substantial gainful activity earnings levels during the period involved.
Slide 13, continued Medicare. Although cash benefits may cease due to work, continued health insurance is possible. Most beneficiaries who will continue to receive at least 93 consecutive months of Part A, also Part B if they are enrolled, and Part D if they are enrolled. There is no premium for Part A. The 93 months start the month after the trial work period is used. To qualify, the beneficiary must already have Medicare and be working at the SGA level, but not be medically approved.
Unsuccessful work attempt. An unsuccessful work attempt is an effort to do substantial work in employment or self-employment that is discontinued or reduced to the below SGA level after a short time, no more than 6 months, because of the individual's impairments or the removal of special conditions related to the impairments that are essential to continued performance of work. There's unsubstantial work activity criteria. A significant break in continuity of work, either not working or work below SGA levels, 30 days. A break caused by the disability or the removal of special conditions. SGA level work lasting more than 6 months is not a UWA.
Impairment-related work expenses, also known as IRWIs. These are deducted from gross earnings, reducing countable income below the SGA level. So an expense for an item or a service that enables the beneficiary to work, it is necessary due to a physical or mental impairment, or it is paid for by the beneficiary. This must be paid for during the month of work activity, and the cost must be reasonable. This also must be approved by the Social Security Administration. For example, a beneficiary is earning $1,500 a month in gross wages. His monthly copay for his medication is $75. Therefore, we would be able to deduct the $75 from the $1,500, making the $1,425 as the new countable income.
Slide 16, examples of an impairment-related work expense deduction. Supported employment services are eligible, as is attendant care, transportation, medical equipment / devices, work-related equipment and assistance, service animals, residential modifications, routine drugs / medical services, non-medical appliances and devices, and services received through community-based residential programs.
Slide number 17, Ticket to Work. Ticket to Work is an innovative program for persons with disabilities who want to work and participate in planning for their employment. It increases your available choices when obtaining employment services, vocational rehabilitation services, and other support services that you may need to keep a job. SSA cannot initiate a medical continuing disability review if a beneficiary is using this specific ticket. A more generous employment network payment plan. So this is also part of the Ticket to Work. Higher milestone payments sooner and more often. Some payments are based on part-time work. Payments are similar for both SSI and Title II beneficiaries. Payments are based on gross earnings, which allow the use of work incentives. The VR cost reimbursement and outcome payments are also available to consumers. Slide 18, which is PASS, or the Plan to Achieve Self-Support. A PASS is an SSI provision that helps individuals with disabilities to return to work. If you receive SSDI or could qualify for SSI after setting aside income or resources so that you may pursue a work goal, you could benefit from PASS. A PASS lets a disabled individual set aside money and things he or she owns to pay for items and services needed to achieve a specific work goal. The objective of the PASS is to help disabled individuals to find employment that reduces or eliminates their need for SSI or SSDI benefits. Expenses that a PASS can help pay for include school or training expenses, which can include tuition, fees, books, and other supplies. This can also include uniforms, special clothing, any safety equipment or tools. Attendant care or child care expenses are also included in the PASS. Transportation for work, employment services such as a job coach, and also supplies to start a business can be used in the PASS program.
Slide 19, expedited reinstatement, or EXR. It's a provision in the Ticket to Work and Work Incentives Improvement Act. Prior to 2001, if a beneficiary was no longer earning above the SGA level after having been terminated due to their income, a new application was required. Effective 2001, a new application isn't needed if certain criteria are met. The EXR provision allows you to receive up to 6 months of temporary cash benefits while the Social Security Administration conducts a medical review to decide if they can reinstate your benefits. May also be eligible for Medicare and/or Medicaid during this provisional benefit period. Expedited reinstatement benefits, or EXR. EXR criteria is as follows: cannot be performing substantial gainful activity during the application month, unable to work at the SGA level due to a medical condition, stop performing SGA within 60 months of prior termination, have a current medical impairment that is the same or related to the original, continue to be disabled based on the medical improvement standards. EXR protects the working individual who was terminated for benefits due to work. It allows that person to re-access the system quickly and be provided with provisional cash and health benefits while eligibility is being determined.
Benefits summary and analysis. What can the benefits practitioner do for you? So the benefits practitioner, they can acknowledge the concerns regarding your return to work. They can provide info on how benefits are impacted by your earnings. They can create scenarios to show options and future potential. Income and resources on various types of employment services. The benefits coordinator can also provide an in-depth custom summary of the benefits portfolio and available work incentives to your specific case. They can also help you define preliminary action steps that you may need to move forward. Develop strategies for using work incentives with timelines and action steps. Identify what supports are needed and when they may be needed. They can also help you to continue to develop a plan towards self-sufficiency and financial independence. And this also, benefits coordinators are able to provide on safety nets and continued coverage while working.
Wage reporting. SSI beneficiaries should ask the Social Security Administration to estimate monthly wages when they begin working. The Social Security Administration will use the estimated monthly amount to calculate the SSI payment unless pay stubs are submitted. Self-employed individuals should contact the Social Security Administration to find out how they can best report their earnings. Regardless of what kind of work activity someone is involved in, we highly recommend that people report their wages to Social Security to avoid overpayments. And Social Security is required to provide a written receipt to all beneficiaries who report wages and work activity information. You should keep those reporting receipts with the other information you have regarding your Social Security benefits. If you need more information or you'd like to talk with us about disability benefits, you can reach me, Marty Seeholzer, at seeholzer.martin@cuyahoga-bdd.org or at 216-767-6849.
If you need to reach me, you can also reach me at vusac.michael@cuyahoga-bdd.org, and you can reach me at the phone number 216-704-8456.